So what is the nurse going to do on the day of your infusion? Like, what does she, please don't do that. What does she do? Does she sit there and color? Does she watch TV with me? Does she read a book? What does she do? I want to know what she does. So on the day of your IVIG infusion, you have a stranger in your house. You have a nurse. She might be awesome, but you're going to have her in your house for 6-7 hours. So what do you do on the day of your infusion? What can you expect? We're going to talk about that. All right, so you got your delivery from the pharmacy. You got probably several boxes of infusion supplies and an IV pole and an IV pump and medication, and you're thinking, I have enough to open my own specialty pharmacy here. A lot of times people are inundated with supplies. But then the other side of that is, I'm told now that I'm infusing this at home that I am going to have the nurse here probably for 3 to 5 days for maybe 5 to 7 hours each day. So you're going to get to know this nurse very well. So on the day of your infusion, well, actually, let's back up. Before your infusion, you will speak to most likely a nursing coordinator or a clinical nurse liaison. They'll ask you if you're allergic to anything. They'll talk about whether or not you've had somebody place an IV on you before and if they had any issues with getting a line on you. She's going to go through all of your supplies when she gets there to make sure she has everything she needs. And she's going to double check to make sure one in particular is there. And that is called the Anaphylaxis kit, or the Ana kit for short. And this is a kit that contains epinephrine, a dose of steroids, extra bag of IV fluids, and maybe some anti-nausea or antiemetic medication. Just a fancy way of saying anti-puke medication, basically. She'll make sure all of that's there, and she should not start your infusion if it's not, just FYI. She'll take your vital signs, and that is your heart rate, temperature, blood pressure, and respirations. And then she will start an IV on you. Very good idea to hydrate at least 48 hours before she gets there, because not only does it help with side effects of IVIG, but it also helps to plump up your veins. So she has an easier time of getting an IV on you. She will then take the medication, hang it on an IV pole. She will start you on a very low rate. Oh, back up. She'll also give you your pre-medication, Tylenol, Benadryl, sometimes hydration, and some people who have had IVIG and know they react a certain way will have a dose of steroids before the IVIG infusion even begins. So after she hooks up the infusion, she is going to watch you like a hawk, pretty much. She's just going to sit there and make sure you're feeling okay. She'll be talking to you the whole time, having a conversation, but really in the back of her head, she's going, okay, they seem like they're doing okay. They're not really complaining. They seem comfortable. She's making micro assessments the entire time. And then she'll just watch you. She'll take your vitals again periodically. And then, you know, for that first hour, she's checking you pretty frequently. And then there is what's called an infusion rate sheet sent over by the pharmacy. And if you are truly asymptomatic, meaning you're not having any outward side effects that she can see or that you're saying, she will then increase or ramp up your infusion rate to go a little bit faster, and then she'll watch you again. You know, it's increase rate, watch, increase rate, watch. And ultimately, the goal here is to get to a rate that's higher and will finish your infusion before the next ice age comes, but also keeps you comfortable. One of the things you might want to arm yourself with is if you do have even a new nurse that's coming, or this is one of your first infusions, I would ask the nurse. So according to your rate sheet, what is the top infusion rate that I'm supposed to get to, and in what amount of time? Because you both can then create a plan for, okay, you know, when we get to this point, I'm expecting to maybe see you having a headache. So this is when you really need to feel, you know, am I having a headache? And if you are, communicate that with me. And then pretty much she'll just tuck herself into a corner and watch you from a distance, periodically go in, take your vital signs, ask you how you're doing, if you're experiencing any side effects. And if not, it's a pretty uneventful course. You know, she'll sit there until the infusion is completely done. Otherwise, you know, she'll just disconnect your IV. If you've opted to leave the IV in overnight, if she's due to come back the next day or the next day, because little tiny peripheral lines can actually stay in for up to 72 hours as long as they're free of any issues. So if you're okay with that and having the dressing and the catheter in place overnight, the upside to that is when she comes back the next day, she does not need to stick you again to start another IV. But the downside of that is if you're not exactly comfortable with keeping a catheter in overnight without her there, or if you're afraid that, you know, if it gets hit or something, or what if something happens, then, you know, so that's a discussion you want to have with your nurse too. For the most part, those catheters stay in without any issue. They're covered with something called a tegaderm, which is one of the world's stickiest dressings ever. And they're usually pretty secure. And the next day, it is rinse and repeat. My dog just fell off my bed. She literally was sleeping and just rolled right off the bed. And, you know, for the next time the following month, it'll be pretty much the same. And gradually, as you have multiple doses, you'll get to know yourself really well. Usually people adjust to, you know, the IVIG, and if they were experiencing side effects in the beginning, they don't really, you know, maybe towards the end, or they're decreased usually, but IVIG is pretty well tolerated. So, you know, if you have any questions, drop them in the comments. I'm going to go tend to my acrobatic puppy here, and I'll see you in the next video. So click here and I'll see you there. No. There we go. Got concerned for a sec.